Okay. Good afternoon, everyone. Today is Thursday, May 23rd, 2024. It is 3 p.m. Central Time. Welcome to the second web briefing of the Iowa Advisory Committee to the U.S. Commission on Civil Rights. My name is Juan Garcia, chair of the committee. I will now conduct roll call on the members' presence. Committee members, if you are joining by phone, please star 6 to unmute yourself and star 6 to place yourself back on mute until I call on you during the Q&A. Vice Chair Henry Hamilton,
Here.
Kyle Bergeson,
Here.
excellent. Paul Fessler,
Here.
Katie Fiala, Adam Freed,
Here.
Cynthia Kohler. Oh, did I hear Cynthia? Nope. Stephanie Munsterman,
Here.
Alan Ostenbring, Alan Ostergren, nope, and Donald Roth. Okay, we have a quorum present and we'll proceed with the meeting. Also present are commission staff, Anna Victoria Fordes, who is our designated federal official, Corinne Sanders, our support specialist, and Victoria Moreno, civil rights analyst, who will be stepping up at the latter half of the meeting. The U.S. Commission on Civil Rights is an independent, bipartisan agency of the federal government charged with studying discrimination or denial of equal protection under laws because of race, color, religion, sex, age, disability, or national origin, or in the administration of justice. In each of the 50 states and the District of Columbia, and more recently established the American territories, an advisory committee to the commission has been established, and they're made up of bipartisan persons who serve without compensation to advise the commission on relevant information concerning the respective state. Today is the second in a series of web hearings examining access to mental and behavioral health care for K-12 students. These meetings will help the committee understand the current issues in accessing mental health care for K-12 students and the civil rights implications, if any. Based on information collected through testimony, the committee will draft a report that will include findings and recommendations that will be shared with the U.S. Commission on Civil Rights. The commission will then forward those recommendations to the appropriate federal and state entities. I'd like to share that at the outset, this meeting is being recorded for the public record, and the web hearing recording will be available on our public database. Please contact Anna Fortes at afortes@usccr.gov if you wish to obtain those records or if you would like to receive notification of future meetings. In a moment, I will invite our speakers to present for 15 minutes. After advisory committee members will have an opportunity to ask questions. The Q&A is reserved for committee members only. After the committee Q&A, there will be a public comment period where members of the public will be given an opportunity to share their perspective and opinions on the topic. If you're not able to share your full remarks today, please email your remarks again to Anna Fortes at afortes@usccr.gov for inclusion in the committee proceedings. After public comment, the committee will then move into conducting our committee business related to planning future briefings. If you're a panelist or member of the public, you may leave or choose to stay on the call if you wish, as all of the advisory committee meetings are open to the public. Before we move into the presentation, I want to remind everyone again that this meeting is being recorded and will be transcribed for the public record. I ask that you please state your name when speaking to assist with the transcription. A closed caption is also being provided for today's meeting. To view closed captions, click the CC icon on the lower left corner of your screen. Though some of the statements made today may vary from personal perspectives, we want to ensure that all invited guests feel welcome and do not defame or degrade any person or any organization. As the chair of today's meeting, I reserve the privilege to cut short any statements that defame, degrade, or do not pertain to the issue at hand. Any persons or organizations that feel defamed or degraded by statements made in these proceedings may respond and submit written statements for submission to the proceedings. I urge all persons making presentations to be judicious in their statement and remain on topic. The Iowa Advisory Committee appreciates the willingness of all participants to share their views and experiences with the committee. Today, we will hear from speakers at government agencies and nonprofit human service organizations with unique perspectives in their respective fields of the topic. Presenters, please aim to stay within your allotted speaking time and reserve additional talking points for the Q&A portion in case you're not able to address them within that time. Anna will be sending you messages through the chat box to let you know when you're near the end of your speaking time. With that said, let's go ahead and get started with today's meeting. We will hear from Karen Mackey, Director, Sioux City's Human Rights Commission, Kelly Garcia, Director, Iowa Department of Health and Human Services, representatives from Lutheran Services of Iowa, Renee Hardman, President and CEO, and James Guentherman, Director of Clinical Services. At this time, I'd like to invite Director Mackey to begin. Please.
Hamatakiapi, Petuashte, Momadi Chante, Wion Imakiapi, Karen Mackey, Washishu Imakiapi, Damakota, Susiri Edwati. Hello, my relatives. It is a good day. My name is Eagle Heart Woman. I'm called Karen Mackey. I am a Two-Spirit Mdewakantawan Dakota, and I live in Sioux City. I'm honored today to be able to speak briefly to you about this important issue. So today I'm speaking specifically about our K-12 children in Sioux City who need behavioral and mental health services and the barriers they face in accessing those services. Many of these barriers are also faced by people all across Iowa, but the issues do seem even more acute in Northwest Iowa because of the lack of the lower number of providers and the lack of facilities, really. In addition, our local school district is made up of over 57% racial and ethnic minorities. We're a very blue-collar community with many employees doing line work, which then makes it very difficult for parents to take time off work to address their children's mental or behavioral health issues. I was actually in a meeting just this morning regarding a young man, and that was a 2.5-hour meeting. It should have been an hour, but there's no way if parents worked an average job, they could have done that. So Dr. Ray Sturdivant, a local pediatrician, was very well known for his work with children, specifically with psychiatric, behavioral issues, as well as ADHD, ADD, and autism. Ray's practice was comprised of about 50% children on Title 19. A number of years ago, under a different administration, Iowa cut Title 19 reimbursements by 25% just in 1 year. The needs of his patients didn't decrease, his overhead didn't decrease, but his income from half of his patients decreased 25%. If he had continued with the same number of children who were Title 19 patients, his practice would have gone under. Ray's wife, Marlene Sturdivant, is also a nurse practitioner, and she worked primarily with at-risk teens. She did that for about 25 years. After years of dealing with a steady decline in reimbursements that they both faced, and what Ray said was this always happened under Republican administrations, they both decided to retire. Even more concerningly, their daughter Amy, who is currently a pediatrician, is moving to Missouri, of all places, to practice medicine. She's going to be paid significantly more money for less work. She'll have virtually no hospital work, very few overnights. But what that leaves in Sioux City is only 3 pediatricians when she leaves. 3 pediatricians for our metropolitan area. That's just crazy. At one time, there were 4 child psychiatrists in Sioux City. Now there's 1 part-time provider. As Ray stated to me, Iowa has chased doctors away by their continual underfunding of services and increased data collection requirements. He also stated that Iowa can reorganize the system all they want, but at the end of the day, there just isn't enough funding to provide adequate services that children desperately need. So I want to talk briefly about the good. What is going on with our service model, if it can be called that? What's helping? Now, these are programs that work entirely with children who are not in need of acute inpatient services. A variety of organizations come into the school setting to work with children. This shortens the time that children are away from classes, plus it eases the transportation burden for the parents. While it would be ideal for the kids to have their appointments after school hours, that's just not always a realistic option for the kids or the parents, and that this way the kids can get the services they need. In 2023, Siouxland Mental Health saw 129 individual children for a total of 837 therapy sessions at their individual schools. Now, that is only a fraction of the children that Siouxland Mental Health sees. They saw 850 children at Siouxland Mental Health in their psychiatric or mental health setting in 2023. But it's far better than nothing. And this is a program that clearly needs to be expanded. Sky Ranch is a behavioral health program, and they currently provide what they call an ART program. ART is anger replacement training. And they do that at the schools, and they're going to be rolling out even more in-school services in the fall of 2024. Post-COVID, the Sioux City Community School District received ESSER funds. ESSER is Elementary and Secondary School Emergency Relief Funds. Some of that money was used in partnership with community organizations like the Urban Native Center, like the Sanford Center that serves many people in the African American community. And they used those funds to fund behavioral specialist positions. And then primarily they came into the middle schools and worked with children. Now that the ESSER funds are going away, Beyond the Bell, which is an after-school program, and Sky Ranch have established a one-year pilot program to fund a behavioral coordinator position. Now, this position will work in 2 of our 3 middle schools, and will also work at the corresponding Beyond the Bell programs that are before and after school to support at-risk children with academic, social, and behavioral needs. This programming is going to include individual, group, and classroom sessions, and we really believe that this kind of thing is vital for kids to be getting a holistic help at school, not just reading, writing, and arithmetic, but help for behavioral issues before they become too serious. So the bad, as I already mentioned, is there are very few local psychiatrists. As I said, 1 part-time child psychiatrist, which means very long waits to be seen by a psychiatrist, which puts additional stresses on the system and the other levels of providers. With very low rates of reimbursement, fewer and fewer pediatricians can afford to provide these services. So more and more kids are waiting extraordinary lengths of time to be seen by anyone. So the ugly part is that there's no acute inpatient mental health services for children here. Often parents take their severely mentally ill child or a child with severe behavioral issues to the local emergency room for help. When the child meets the criteria for inpatient services, there's nowhere to immediately place them. And the child can languish for days in an emergency room, using up needed space and staff while a placement is located and transportation is arranged. The closest acute inpatient services are 90 miles away, either Omaha, Nebraska, or Sioux Falls, South Dakota. That's problematic for many reasons, especially for middle and low-income parents, because their ability to participate in their child's recovery or even just visit them is limited. Children are sometimes, frequently, if I were honest, sent over 200 miles away for treatment, making parental involvement even more problematic. A Zoom call simply cannot take the place of physical interaction between parent and child. I know a boy that was placed in a Sioux Falls hospital for about 8 months when he suffered a mental break as a 10-year-old. After he was released from the hospital, Chris was placed in a nearby group home for several months until he eventually reported that he was being sexually abused by an older boy in that group home. It took Chris years of therapy to recover just from his post-hospitalization trauma that never should have happened. To go on, waiting lists for placements in a psychiatric mental institution for children can be 3 to 6 months or longer. Insurance also causes long waits because you have to have an additional assessment to even qualify for the children's mental health waiver. Now, once approved, the child and the family has access to additional services to keep them in their home, but that's assuming they're still in the home. But unfortunately, the service provider then also has to be approved for the waiver. And these services are extremely limited in the Sioux City area. BHIS, or Behavioral Health Intervention Services, those are great programs. A provider comes into the child's home and works with the child and family on skill building and applying what they're learning in therapy to real-world situations. This is a Medicaid-only service. Private insurance will not cover those services. And there is only one agency in town that's currently even accepting new clients. So BHIS is a great thing, but it's very limited in who's actually benefiting from it. And my final comment today would be about LGBTQ plus kids. So I am a member of Siouxland Pride Alliance. And in 2023, we increased our youth support group from meeting once a month to meeting weekly. The children were so traumatized by the legislative attack on their very existence, and subsequently then being targeted by their classmates and bullied, that their mental health suffered, and it really continues to suffer. We have been meeting with these children now weekly for 2 years. We had one recently that we were just trying to get them through the school year because they were expressing suicidal ideations because it was so traumatizing just to go to school. Those children are suffering. They need all of our help, and they need the legislature to quit attacking them. Thank you very much for allowing me to speak today.
Thank you, Karen Mackey, for your comments. Now, at this time, I'd like to invite Director Kelly Garcia to present.
Right. Good afternoon, everyone. I'm Kelly Garcia. I'm the director of the Iowa Department of Health and Human Services. It's inaugural director, as we are now a consolidated health and human services structure. So legacy DHS was the Medicaid agency, child welfare agency, but we've combined with the public health agency. And I want to give a little bit of orientation to that work right now. So our agency is home to a number of supportive services, and some that you may not be familiar with. We've really shifted and addressed a number of issues that were just raised by the previous speaker. And I want to dive into that a little bit deeper today. And then obviously, I'm sure you will have some questions. So we are the public health agency, as I mentioned, the Medicaid agency. We cover food benefits, child welfare, foster care. We also operate our own facilities through our state-operated specialty care network, which includes 2 state mental health facilities and 1 that specializes in treating youth, both children and adolescents. And I'm going to dive into that a little bit deeper here in a second. So our agency has a lot of touch points across behavioral health. In fact, the impetus for our agency coming together was centered around behavioral health. When I arrived in Iowa just a little bit more than 4 years ago, I came to be the Legacy Department of Human Services director. And I asked the team, tell me about our behavioral health strategy in the state. Our agency at the time was operating the mental health and disability service structure, not really overseeing it, but working closely with those regional structures. But it was really squarely focused on mental health and its counterpart work, substance abuse, to really frame out that behavioral health network was sitting over in the Legacy Department of Public Health. Not really talking to each other about a framework around the needs of humans and co-occurring needs of complex diagnosis. And similarly, even within the own agency, our team members were not really thinking about the force of the Medicaid program, which the previous speaker really honed in on. The vast majority of children with behavioral health needs receive their services not through the structures I just named, although they have important roles in providing access points, but through a payment structure, an insurance structure through the Medicaid program through Title 19 or CHIP. And so we know that there is incredible work to be done in this area. And I certainly, over the last 4 years, have kept a finger on the pulse. And COVID certainly changed the world that we live in today. And I'm going to give you some statistics to kind of paint the backdrop, and then I'm going to dive a bit deeper into the work that we are thinking about. So coming back into the summer of 2020, the governor asked me to serve as the public health director. And that was a time that really allowed me to dive incredibly deep into the needs of what Iowa is focused on, to get a pulse on what clients in the Medicaid program, caregivers, providers are struggling with. It was a very, very important time, and coming right out of a transition time in the Medicaid program with a new managed care organization. And I learned a tremendous amount through those first couple of years. I also spent a lot of time talking with a significant number of individuals with lived experience. And we have some individuals with lived experience on our own team here at Iowa HHS. We take that incredibly seriously. And will always remember being meeting with 2 young women from Mackey High School here in the metro area who are phenomenal young students and created a marketing campaign on their own that they wanted me to view and then ultimately promote, which we did, around the stigma associated with mental and behavioral health issues. And so I just want to know that there are a tremendous number of champions, many of them youth themselves, who have very, very strong voices and have contributed to exactly what I'm about to lay out for you today in terms of our focus areas in the agency. But first, I want to share a bit of background. So I was with our clinical director late last week out at our Boys State Training School, Juvenile Justice Facility in Eldora, Iowa. Dr. Derek Hess is our clinical director. He's a forensic psychologist and an attorney by training. And he recently shared a study with me and the team that I thought was had a lot of statistical detail about behavioral health. In total, the number of people with behavioral health conditions has approximately doubled in the last 3 years. So when we talk about provider access, we talk about the need. There is a cataclysmic event that has occurred through the pandemic when only about 20% of the population in pre-pandemic times experienced these conditions. But today, these numbers have doubled to approximately 40%. And we know that through our regular public health surveillance that Iowa students are indeed struggling. And this study absolutely underscores those data points. This alongside with an increased severity and complexity, which I'm sure Renee Hardman is going to dive deep into, and her colleague at LSI. We partner with them very closely on serving some of Iowa's most vulnerable youth and adults for that matter. But the silver lining in this is that that work and these deep data points have allowed us through our kind of traditional public health lens to have incredible data around the experience of Iowans and provider availability. So we perform what's known as the Iowa Youth Survey. We know that depending on the year, but and our data lags a bit, but our most recent data shows us that about 27% and 36% of students, and it depends on the grade, reported that they felt sad or hopeless almost every day for 2 weeks or more in a row. A greater proportion of female students than male students And that is a substantial difference. 41% of female students, as compared to 20% of male students, reported that they felt sad or hopeless for almost every day for 2 weeks or more in a row, and that they stopped doing their normal activities, which of course we want no young person to do. Female students also reported higher rates of suicidal ideation than males. More than 1 in 4, 27% of females indicated that they thought about killing themselves in the past 12 months, as compared to 14% of males. And those are shocking numbers. The why behind these numbers are absolutely complicated. They are complex and they are nuanced. And we as an agency are committed to digging in and to understanding why. We are working very hard to understand the impact of social media use and its prevalence. Something that has occurred in recent years that is focused on lack of hope and lack of resiliency. And we are working with the University of Oklahoma on the evidence-based science of hope, which is an absolutely phenomenal framework to really think about how to approach these complex issues beyond the clinical support that we know that individuals need. And as we begin to understand why, we start to shift our approach to address very specific populations about how to best support and serve individuals. And as I mentioned, we are a lifespan agency, we're the public health agency, but we also run a number of deep end services, including supporting youth in foster care, youth and child welfare overall. Iowa's child welfare system absolutely strives to ensure that children coming into its care are met with evidence-based services that aim to heal trauma, support a person-centered care plan rooted in permanency, while planning for an individual's agency and independence, which everyone has and deserves to have. Iowa also strives to ensure that youth have an outlet and a voice to voice those concerns regarding all aspects of their care, especially for our Medicaid members and for those in child welfare. In the child welfare side, Iowa has codified these tenets and core values and policy and practice through the Iowa Foster Care and Youth Bill of Rights. And so we have now, through our agency alignment process, a significant way to hear directly from youth. We have a youth engagement office in our agency, and we hear from youth directly. And that is part of our work. It informs our practice and will continue to, as we think about the really big initiatives I'm about to outline. So as we came together as a new Iowa Health and Human Services Agency in full form about a year ago. It'll be a year ago in July. But as Legacy Public Health and Legacy DHS just a year before that, we are new to our work and again, really thinking about these very complex topics across all of the areas that we have in the agency, so that when we think about complex problems to solve, we are thinking about system solutions and not just one facet of solving a very complex problem. So after we aligned as an agency, we took it upon ourselves to do a holistic assessment of the extension of us, our HHS system. And that came right after we did some very, very significant analysis around provider capacity and gap analysis, focused on community capacity across serving individuals with behavioral health needs and individuals with disabilities and co-occurring conditions. And that data led us to some really significant work that passed this session. So this coming year, we will be diving into a behavioral health redesign focused on what is known today as mental health and disability service regions. In the future, what will be known as behavioral health districts, really focusing on access points, ensuring that all Iowans have access to high-level clinical care, evidence-based practices, and that is not based on region design, really thinking about strategies to the earlier presenters' points, that where we have areas of deserts or not enough access points, that we are driving funding to those spaces, thinking about pipeline building and creatively solving for those challenges. Coupled along that work, because that work is important, but as I mentioned to you in the beginning of my talking points, that work matters for access design and system design, but the payer source for most children in Iowa is Medicaid. We have launched a number of really key things that change the landscape in this framework around behavioral health and supporting the individualized needs of children in the state. So when I arrived, our agency did not have a regular rate review process for Medicaid rates. And I think Medicaid rates came up again in just this previous presentation. We now have a regular rate review. And for the last 2 sessions, our governor has put forward initiatives. The legislature has endorsed historic level increases in behavioral health rates in the Medicaid program, and that is significantly needed. It has been a very long time since those rates have been adjusted. And now that we have a regular rate review process, we fully believe that we will never wait quite as long to see those rates reviewed. And rates are one very key component of ensuring access across the state. Coupled with that is a complex design. It was mentioned, the Children's Mental Health Waiver. Our Medicaid waiver redesign is complex, and the service array and service packages are not meeting the needs of Iowans today. And we know that. We know that through the deep analysis that we have done. And so we set out a little bit more than almost 2 years ago to start work on redesigning our waiver system in the Medicaid program. So we have brought Iowans to the table with us to redesign the service delivery and policy framework for our waivers. We are going from 7 Medicaid waivers who support individuals across all kind of disability profiles to what looks like it might be 2, where we've heard some feedback that there might be a 3rd category there, but really kind of thinking about discrete populations of the need of children and the need of adults. But really going from that diagnosis-based waiver to a needs-based waiver, which allows a more fulsome benefit package to meet the needs of individuals. And there are a number of individuals that, because humans are complicated, and individualized needs need to be ever present in our Medicaid program, that we will be able to tailor that work and meet the needs as they change, which they inevitably do, across people's age groups. Coupled with that is real-time assessment. So we are going through a process right now of, assessment is part of a waiver package. We have to understand what level of service an individual needs, and then again, tailor that programmatic design around them and their specific needs. And that process has been lengthy and somewhat cumbersome, and we are absolutely overhauling that process again with Iowans at the table, assisting us in that design and development. It has been a remarkable experience and really led by the governor's vision of making sure that the Medicaid agency and the complementary counterparts here at HHS are meeting the needs of Iowans first and foremost, and that we don't have a bureaucratic design that works for us but doesn't work for Iowans. So those are 2 really significant changes here that are well underway, have had a phenomenal amount of input from Iowans, of which we are incredibly thankful for, but they're 2 really significant cornerstone items, but they're not the only things we're doing in the program to ensure that we are really shoring up those access points and filling in the gaps where we lack specialization today. We are thinking about our role in specialized services. We have recently tailored the care that we give, as I mentioned, in our 2 mental health institutes, really focusing on the unique needs of children and adolescents, and thinking about not just mental health needs, but also behavior needs in those facilities. We also are thinking about our own role and the agency's role in building out pipelines for clinicians. So we've launched residency rotations in our facilities in partnership with the University of Iowa hospitals and clinics. And we are seeing some really phenomenal progress in child psychiatrists at our Independence facility, not only learning and practicing, right, on getting those clinical skills on some really complex youth who are in our care within Independence, but also we are benefiting from a rich array of new clinicians, some of whom are already talking to us about staying. And that is a wonderful effort that we can continue to build on. This last session, we also went to work on ensuring that we are thinking about the other places in our system where there are gaps. And so Ms. Mackey mentioned that PRTFs, which is that inpatient level of care sitting just under a hospital level. It's still deemed a hospital level. We call them PMICs in Iowa, but in other states, they're called PRTFs. That we have waiting lists, and that's absolutely accurate. We are thinking about that long and hard. We went to the legislature in partnership with a number of provider associations and proposed two key things. One is that we are going to be bringing a new provider into this state, a provider that operates in 13 other states and serves incredibly complex needs. And in fact, we send a number of Iowa's children to their other locations, and we very much want to bring those children back home, close to their families, close to their networks of support. And so this new provider will be landing in Iowa, and we are working very hard on that. And the legislature has made a really significant investment in bringing them here. The other complementary piece of this is that we will be launching a specialized rate for this higher level of care in a PMIC setting, and really make sure that we are meeting those tailored needs. And there is significantly more work that is happening in our agency, but that gives you the backdrop of the way we are thinking about these complex issues. And I'm thankful that you invited me to be here today.
Thank you very much, Director Garcia. And perfect timing. I was just 15 minutes just went up. At this time, I'd like to invite representatives from Lutheran Services of Iowa, Renee Hardman and James Guentherman, please.
Okay, thank you very, very much. And thank you for this opportunity. We do have a PowerPoint slide that we'd like to just share. And again, it was really neat hearing from the two prior panelists as well. You learn something every time you're in the room with folks that are charged with trying to be a part of the solution. So my name is Renee Hardman. I am President and CEO of Lutheran Social Services, LSI. Tomorrow is my 4-month anniversary. And so been drinking from a fire hose, learning a lot, but really, really want to share with you that we are an organization that is 160 years of age. We have about 425 employees, and we provide a variety and a host of services around early childhood and foster care and adoptive care, immigrant and refugee services, migrant services, global greens, mental health therapy, and work with persons with disabilities. HHS is a partner of the work that we do, along with other significant partners that allow us to do this vast array of services that try to improve the lives of Iowans. Before I get started into just a few things on this first slide, I'd like to just make a few opening remarks that are kind of near and dear to me, and why I'm really proud that LSI is in this space of trying to work with K through 12 youth. Is that, you know, when we talk about this space, while the population we serve is broad, you know, racial and ethnic minorities have less access to mental health services. It's proven, tried, and true. And so for youth in foster care, where there are a disproportionate number of Black youth, mental health issues are huge among teenagers, with close to 40% that have had some type of mental health disorder. Over 1 in 5 youth ages 13 to 18 either currently have some type of mental health challenge. And so the impact of not addressing these adolescent mental health issues have long-lasting effects in adulthood, and we see that played out in so many ways. So I just want to share with you before I introduce my partner in this, is that LSI employs about 32 licensed therapists who currently provide direct care to over 600 individuals via in-person or virtual mental health services. We serve all 99 counties. Approximately 55% of the individuals we serve are students K through 12 as it relates to therapy. There have been 7,300 therapy sessions so far this year. We serve 20 plus schools across Iowa. And we provide trauma-informed care services in 5 out of the 9 detention centers across Iowa. So that gives you a little bit of scope about what we cover and what we do. The services that we provide for Iowa students are around school counseling services, peer support programming, mental health education and awareness programs, telehealth services, mental health screening programs, and support groups and workshops. So when we're in these 20 plus schools across Iowa, these are the kinds of things that we are working on and trying to provide support for these adolescents that need us. So I'm going to turn it over to the person that really carries the weight in all of this and really supervises our therapy department. It is the Director of Clinical Services, Jim Guentherman, who can share with you more about what some of these barriers are and some of the challenges that we face in trying to help the lives of our most vulnerable, and that's our youth.
All right, thank you, Renee.
You're welcome.
All right, so as Renee mentioned, my name is Jim Guentherman. I'm the Director of Clinical Services and a licensed mental health counselor at Lutheran Services in Iowa. First off, I'd like to express my gratitude for providing us this opportunity to discuss the important issues we see concerning mental health services and the barriers that people in kindergarten through 12th grade have. I've been in the human service field for over 20 years, and I've been a licensed therapist for 10 of them. Doing this work every day, I see the barriers kids face with accessing mental health care. For instance, in Iowa, for every 500 individuals, there's only one licensed therapist. It's even more difficult for kids to access care due to the many licensed therapists only focusing on adult services. There's also things like lack of transportations, the working family, and just scheduling conflicts, because we all know there's only so many hours in the day for these people to be seen. Okay. Funding for mental health services also varies depending on the institution, region, and available resources. In many cases, mental health services in educational settings are underfunded, leading to challenges in meeting the growing demand for support. Limited funding can result in long wait times for appointment, insufficient staffing levels, and a lack of resources for comprehensive mental health programming. In our school-based programs that we provide through LSI, schools cannot cover the cost of therapy services due to many different factors. This leaves the family to rely on their insurances, and most of these families have things like high deductibles, high copays, co-insurances, and sometimes no insurance at all. This forces these families to make difficult decisions about what's more important. Sometimes it's putting food on the table, and sometimes it's attending their therapy. Just yesterday, I talked to a gentleman who was looking to get his 2 kids into therapy services. He let me know that he was unable to find an opening appointment anywhere that was within the last 2 months out. Sorry. So he reached out to me because I know him personally, and he asked if there was a way that he could get in to see LSI any sooner. We're working on getting him in within the next 48 hours. But unfortunately, we're unable to accept his insurance. He has an insurance that is only paneled with one of the local hospitals. And just please note, we would accept this insurance, but that insurance only panels with them. So because of this is a hit that LSI would potentially take, because this would have to be a service that we provide potentially for free for this individual. And that's something that happens for agencies like LSI all over the place, because we do this work working with these people on the lower income side of things, and we want to do this because we care. Okay, next slide. Okay. So as hard as it was for this individual to access services, there's other populations who are more affected by the lack of resources for mental health care. I know I touched on the barriers that children in schools, but it's even more difficult for minorities, individuals with disabilities, and low-income families to find providers that work within their demographic. Many therapists are not paneled, and this is by choice, to see low-income families on Title 19. This is due to what's been mentioned already for low reimbursement rates and high cancellation rates. This puts a larger burden on agencies like Lutheran Services in Iowa to serve a larger portion of this population. Minorities have an even more difficult time finding a provider that looks like them and that can relate to them. This causes a lot of people to just not seek out therapy, which we all know that's not beneficial to anyone. Okay. In different regions, it can be very difficult to receive mental health care. We're from Iowa, most of us here, I believe. So we know Iowa's pretty rural. So in those rural areas, there's even a greater shortage of mental health providers, which limits most of those people in those areas to travel outside of the area long distances or access therapy through telehealth services. Even though telehealth service is a great option, it's not always the most ideal. It's not always user friendly. You need a good internet connection. And let's be honest, we're talking about kids K through 12. They don't have a very large attention span, and getting them to sit in front of a screen for 45 minutes to an hour, unless they're watching a TikTok video or playing a video game, is very difficult. So I believe that addressing the regional disparities in accessing mental health care requires the improvement of the healthcare infrastructure, such as increasing mental health capacity through higher reimbursement rates, reducing the stigma of mental health through public education, and promoting sensitive care to meet the diverse needs of populations in different regions. Some of these regions have more comprehensive coverage and funding, while others face limited resources and budget constraints. And I know we talked, Director Garcia talked about the region redistributing, and we're hoping to see some of those funds go from some areas to those areas that are, desperately in need. So I think from our side of things, we really appreciate that, and we're hoping it's going to work the way it sounds. All right. Okay. So like I've been saying, it's crucial for policymakers, educational institutes, and relevant stakeholders to prioritize mental health funding, allocate the resources strategically, advocate for more funding at all levels, and explore partnerships with community mental health providers. Okay. So, one of the questions were like, if we were in a perfect world, what would resources look like? I know this answer doesn't fit completely to that, because if there was a perfect world, none of us would suffer, but we know that's not ever going to happen. So if resources and funding were not a barrier to mental health services, the landscape of mental health care would be significantly improved in several ways. For example, if we had increased accessibility, services would be readily available and accessible to all individuals, regardless of the barriers that we've all talked about today. We would have more early intervention services that allow us to be more proactive instead of reactive. We would have an integrated model of care that provides a more holistic approach for individuals in need. We would have a sustainable system that did not require agencies like ours to fight other agencies for the limited funding that is out there. So in essence, a scenario where resources and funding are no barrier to mental health services, it would result in a more equitable, accessible, comprehensive, and effective mental health care system that meets the needs of all individuals across diverse populations and communities. And again, I appreciate the chance that you all allowed me to talk today about the barriers that we see with our kids from K through 12. And now I'd like to turn it back over to Renee for one final comment.
Well, we're pretty much done. In interest of time, we'd just like to leave with the final quote here. Is our dream for the future is that at LSI that we are fueled by the power of the human spirit and driven to create stronger Iowa communities. Our work isn't done until every student has access to quality mental health services and is able to effectively meet the world's challenges. So again, I'd like to thank you for the opportunity to share our thoughts a bit about what we do. We do it because we care. We do it because we try to make sure that all Iowans and young people have an opportunity. There are some things we do well. There's some things we don't do well. But in this therapy space, this is where we want to grow. And this is where we think we can have a greater impact. So thank you so much for this opportunity to share with the esteemed commission.
Thank you. Thank you very much, Renee and James, for your comments. Before we move into the Q&A section, I'd like to remind members of the public that if you're interested in offering public comments following the Q&A session, please raise your hand by hovering your mouse near your name to let the staff know that you would like to speak. We will add you to a list and we'll announce your name when we're ready. We will now move into the Q&A portion of the meeting. We will have a limited amount of time, so please be succinct with your responses. I'm saying to the committee, please indicate if you have a question for a specific speaker or if directed to all speakers. If members have additional questions, I'd like to ask you to use the raise hand function. And for members joining to the phone only, you can press *6 to raise your hand. And you may also unmute yourself by pressing *6. I will now call on each committee member to see if you have any question for the panelists. Please.
I guess I'll begin. I want to thank the panelists for this informative session today. And I know we're supposed to limit ourselves to just 1 or 2 questions. So my first one doesn't count against me. It's more of an inquiry. And that's for Ms. Garcia. You mentioned a study. Has that been provided to us, or are you willing to provide that to us?
Well, I mentioned, I think, a lot of studies, so you'd have to
Oh.
be a bit more specific, but we publish all of the materials that I referenced today on our website. I'm happy to point you in the right direction, but no, I did not provide anything ahead of time.
Okay, no, we'll go
Happy
to
to.
your website and grab those, that study. I was interested. It looks like the note said the doubling from pre-COVID to COVID.
Oh, that one. No, I did not, and that is not on our website. That was an internal article that we were reviewing with our clinical team, and I certainly could provide that to the committee if you are interested.
Yeah, I think that'd be great. Thanks.
Certainly.
Right. And then for Guentherman, you had mentioned the importance of folks in need, young children in need of these services, the importance of being able to talk to someone that can relate to them. And in your duties as a licensed mental health counselor, can you tell us the importance of that, and then I will squeeze a second one in there for all the panelists. And that's, we mentioned a lot of demographics as far as providers available and who needs these services. And is there a place we can look to see the demographics of A, the providers, and then B, the folks that are using these services? But the first question was to Mr. Guentherman.
Okay, thank you for the question. So the question was, why is it important for children to have access to somebody that can relate to them, essentially? And I feel it's very important for communities that, you know, and I'm just going to talk about some of the kids that I see personally. I know they would relate better to people that look like them. There's history that I know about, but history that I wasn't part of. So when they talk about that kind of stuff, they know that I haven't been through it. They know I haven't suffered the generational trauma that's been through some of that. They just know I'm a guy that can talk to them about things, but I feel that it's more important. And I believe there's data that shows that when you're working with somebody that has an understanding of you and have been through similar things, you relate better to them and your progress comes quicker. I also work with a lot of veterans. I am a veteran, so I see progress relating there because I can relate to what they've been through, and they know that I'm just not some guy sitting there, you know, trying to collect a paycheck. It's like, I truly care. I understand what you've been through, and I want to be there for you. So I hope that answers your question, Henry.
Yes.
Okay, thank you.
Yeah. And then the second one was what to all three. It had to do about information. We can find the demographics of the clients, the demographics of the providers, and I guess the demographics of these deserts that we talk about.
I
Jim,
can speak.
you address what you can on that. So,
oh, sorry.
no, I said I'll let you address what you can on that. Go ahead.
So I was going to say, we like demographic wise, we track all demographics at LSI for all clients that come through our door. So that would be information we could gladly get to you. If there's specific information you're looking for, if you wanted to email Renee and we'd be happy to get that to you.
And Henry, for Title 19 and CHIP, we publish a Medicaid dashboard on our website. We've actually won a national award for our transparency on the data that we push out in the Medicaid program. You can go and search all sorts of things, but inclusive of that is age groups, gender, race, county. And so you can kind of play around with it. Obviously, we have to make sure, because we don't get so low on zip code level that we could identify who the people are. So it's a little bit, up by county, but it is a wealth of information around coverage lines and other kind of access points as well,
All right,
as well as funding.
Thank you. Paul?
Yes, my question is briefly from all three of them. Our committee is looking at civil rights. So specifically, do you see where there's any issues of access or discrimination for mental health for these children in race, color, religion, sex, age, disability, national origin, administration of justice? Which are some of them that this committee could address? Thank you.
I'd just like to take a stab. I don't know. I just know there is research and studies out there that acknowledge and lift up that minorities and marginalized communities have much more barriers to overcome for access for a variety of reasons. It's where they live. Your zip code is the #1 indicator of what services you can access, how successful you can be, and all of that. So even just the notion of studying COVID, that lifted up how that affected marginalized communities, communities of color. Mental health is no different. And so while I can't give you the exact number, I know that there are barriers to overcome. There's poverty issues, there's access issues, there's transportation issues, there's education issues that affect marginalized and brown and Black people disproportionately. And so we as providers have to try to work around all those barriers and try our best to chip at them little bit by little bit by little bit, so they can get just the simple access of a listening ear, a compassionate provider to help deal with the crisis of the moment. And our staff have to work extra hard on trying to get rid of those barriers and eliminate those barriers and find ways in which we're accessible. That's why we have therapy right here, right on University Avenue, where there's a bus line where we can have these families come and get off a bus and walk into our place, because they don't have money for Uber, they don't have money for Lyft. Telehealth can only do so much. So they're encumbered by so many other things that get in the way of their mental health and the things that they need. So I think mental health is a human rights issue, and we all need to do, and we all are in this space because we are trying, is to do what we can to break down as many barriers as we can so that these kids can thrive. They already have challenges, and then you add all this other stuff around it. It's no wonder we have, look at the incarceration rate here in Iowa and the disproportionate incarceration rate of people of color. That's a lot of things that are inherent in being reactive versus proactive. That's the best way I can address your question as it relates to how we approach this, and that they're just are.
Thank you, Renee.
Renee, it looks like you were muted there for your last sentence. If you'd please like to repeat it.
Okay, I was saying those are just some of the basic kinds of things that I think we need to lift up in the community so that everyone has an opportunity for just the minimum basics.
Ms. Hardman makes an excellent point. It really is making sure that everyone has access to the services and that service providers really do need to go above and beyond to help people access those services because of all the barriers that they face. Well said.
Thank you, Karen. Anyone else? I don't see, and Victoria, I don't see any other hands up, do I? Oh, Stephanie. And then I'll come back to you, Alan.
Okay.
Perfect. You're muted, Stephanie.
Sorry, I was having technical issues. I'm on the phone and on here, so I unmuted one and not the other. First of all, thank you to the panelists for your time and expertise today, and thank you for the work that you're already doing. My questions are in relation to a couple of things, but Karen, you mentioned about the intersection between LGBT, gender identity, sexual orientation, and the impacts on youth compared to their peers. Can you talk a bit more about that? You mentioned, of course, there's more weekly times at their meetings. Is it access to therapists who are willing to work with them, or is it kind of all of it together where there's not access, there's families who don't support the youth and won't take them to therapy? So what are you seeing as the big nuggets in that problem?
Okay, I think it's a combination of everything. The children that we're dealing with at Siouxland Pride Alliance, though these are kids whose parents are willing to have them participate in our activities, so they are supportive at some level, but kids are undergoing a lot at school, being bullied. Anytime LGBT issues come up in the legislature, whether it be in Iowa or another state, but once that's in the news, it's like a target on some of these kids. And so they have all this going on at school. They're being bullied. And many of these kids are actually middle school. So think back to when you were in middle school. I don't know about the rest of you, but I was a hot mess at that age. It's so tough to be a kid that age or work with people that age. They just have so much going on, and then you layer this on top of it. And then some of the children I've noticed don't even realize just how supportive their parents are. And so they don't see the support they're getting, but they certainly see how the outside world views them. And just layered on top of everything else, it is a problem. And then we have kids, even within our own group, are acting out. They have behavioral issues attending our group because they have so much going on that they end up doing that. And so it's kind of hard for everyone. We actually have so many kids now that we're having to split the group in half. And now we're going to start having a younger group and an older group because we have even sometimes children within the same family who are attending that, identify as a part of the LGBTQ community. So there's a lot of things going on. And like I said, these are the children who have largely supportive parents. These aren't the kids that are, don't have parents who support them.
Thank you. I do have a follow-up question related for everybody, because you mentioned acting out. And I was curious about the criminalization of mental health and contact with police, with progressive discipline that's not necessarily followed in schools. So I'm just kind of curious what you're seeing as those challenges for the kids who are not being seen, whatever arena that they're in, and how that impacts their police contacts or criminalization of that. And that's for everybody. Thank you.
I can talk a little bit on, but what I see with a few kids I work with, they get in trouble a lot. They get charged a lot, and it really comes down to people that they're working with not understanding their trauma. It ends up being they're getting arrested for something where if there was a provider around that could help de-escalate a situation, charges would never happen. So there's I want to say probably 3 kids that I see that have charges right now. And it's all stuff that in my mind, I keep thinking like this could have been avoided if they would have just let them do whatever. And I know we have IEPs in schools and things like that. And this isn't me blaming anybody in the school for lack of understanding and knowledge. It's a lack of, we just don't have enough providers that understand this stuff. And I don't know how to fix that. I know we talk lots and lots and lots about how do we fix these things, and I don't have answers, but I'm happy to sit and talk with people about how do we fix these things, because I don't like to see the kids I work with get charged. I don't like to see their lives get thrown away at such a young age when all they did was make a mistake. They're not bad kids. They made bad mistakes. So that's what I see. So.
Thank you. Alan?
Thank you, and I apologize. I had to join the call a little bit late. I had another meeting. Mr. Guentherman, you mentioned that there were studies about the relationship between counselors and other professionals who can, I think you say, identify, the kids can identify with them, shared experiences. You use the example of that you're a veteran working with veterans and whatnot. If there's literature that you have that would back up that, I don't doubt it the way I say that, but if you could give us something, links to that or something like that, I think that'd be helpful for the committee to follow up on that. And some of the other questions I had were asked by other people, so I'll yield the balance of my time to the other commissioners. Thanks.
Thank you, Alan. Anyone else with questions for the committee?
And Juan, you're on mute if you're speaking.
My apologies. I was coughing earlier, so I had to shut it down for a minute. Okay, we're going to move into the public comment. Thank you. Thank you to our speakers for your testimony, your passion, and for everything that you do. We appreciate your involvement. And this is an opportunity for the public to offer comments to the committee about this topic. Please keep your comments limited to 4 minutes. If you would like to make a comment, please raise your hand. If you're joining by phone, you can press *9 to raise your hand. Please also know that you may submit written comments by email to afortes, AFORTES, @usccr.gov. Let's go ahead and see if we have any members of the public who would like to make a comment. You can see the comment on the chat from Victoria, and I don't think we have any hands that have been raised yet. Give it another second. Okay, we will continue then, since we don't have any other comments. Please note that there's going to be more wet hearings scheduled, and we welcome to join us. We plan to have our next one next Thursday, next week, May 30th at 3 p.m. Central Time. In the chat, staff included information on how to register for this web hearing, so you'll have that information to use. Thank you for joining us. We appreciate your time, especially to our speakers. and look forward to having you join our next few web hearings. For the members of the Iowa Advisory Committee, please stay on the line for a few more minutes for our business meeting. Everyone else, please feel free to stay on to join the business meeting. Otherwise, please enjoy the rest of your day. Have an excellent Memorial Day weekend coming up. And thank you again for everything that you do. Thank you. Committee members, please stay.
Stephanie, you're on mute.
Yeah, I'm sorry, I'm on two devices. I did have a question, but it looks like we lost some folks. I had my hand up, perhaps that you didn't see that.
Oh, my apologies. I was asking for help because I couldn't see. I don't get to see everybody on the screen when running this
Okay.
thing. So
Okay, I
My
can
bad,
ask
I should
another-
have brought that to your attention. Sorry about that.
no, we're good. Just for next week, just to make sure that we keep checking with Victoria or Anna, just since they manage the background, to make sure that we don't miss any hands.
And if I may,
For-
Chairman, just a reminder to the committee, you can submit follow-up questions to the panelists, to Anna.
Okay,
so that
that's
she
gonna be
can
my next
share with them
question.
in
Okay.
writing. Mhm.
That's true.
Okay, great, thank you. You answered my question.
And
There's
I
one of
will
them.
send also all of them a thank you on behalf of the committee for taking the
Mhm.
time preparing the presentations and everything they share. So I think that's good practice, and also that continued collaboration, right? To make sure that if we have additional comments, additional questions that might come up, we're all working together. So, okay, that being said, announcements. What do we have for the web briefing materials, Victoria?
Sure, thank you, Chairman. And for those of you who may have joined late, I'm Victoria Moreno. I'm another civil rights analyst here at USCCR. I'm a colleague of Anna's, stepping in for her as she had to log off a few minutes early. And as far as the web briefing materials, I know that Anna wanted to share that as far as the recordings, transcripts, and other public records for your briefings, we are transitioning to a different platform. We'll be creating a new link in box.com that's going to be shared with you all. And so Anna will be in touch with more details for that soon. And then, as I just mentioned, Anna will keep an eye out for any follow-up questions you may have for any of the panelists, and she'll compile all of those and send to them. So if there's anything that you weren't able to ask today, or a new question that comes up in the next few days, please reach out to her with that information.
Perfect, thank you. I think we covered the second item that talks about the question for the panelists. So if any of the committee members have any additional questions, or as you go through this, something comes up, we can email them. Henry.
Well, yeah, I don't have an additional question of the panelists, but during their discussion, there seemed to be several sources of information that were revealed that I think would be beneficial to the committee. And I didn't know if the committee members should gather those, or if staff will gather those, or even request those of the panelists. I think most recently, I believe Alan asked Guentherman for the research to back up his statement that the children have more positive outcomes when the person that they're talking to relate to the child, or in that case, a veteran. And then I asked for a copy of that most recent study from the Iowa department that talks about the changes pre-COVID and now, and perhaps there might be some demographic material in there as well. And then we requested from Lutheran social services, whatever demographic is available regarding providers, where these deserts exist, and also the clients. And I think all that information would be relevant to our final report.
Yeah, I agree. Thank you.
So one suggestion I have on that is to submit them in writing to Anna, but also when she receives a transcript in about a week or so, that'll be another opportunity to really hone in on any specific external sources that were mentioned that you're interested in taking a look at. And that way we know the name of them, if they were named, or just more details so that Anna can follow up with them and request those.
Okay, so you suggest we, once the transcript is prepared, that we follow up with Anna for a follow-up with Anna.
And but
Okay.
also the questions that you just mentioned, if you can send those to her in writing, in addition to anything that you'd like to point out from the transcript, that would be helpful.
Okay, sounds good. Thanks.
Any other committee members that have a question? I don't see any more hands up. Okay. Let's move to
Stephanie, it looks like she raised her hand.
Hey, we didn't miss you this time.
Hi, I did a quick search around representation and did find a couple of articles that I can send around. Because there's one that's like a meta-analysis that looked at about, looks like 438 different studies. And it's interesting because it does talk about how the lack of representation also impacts, like, you can't be one if you don't see one type mentality, basically, and how some topics would not be raised in therapy if there's not representation. So I thought this was really interesting. So I can share this out as well.
Oh, please, yes. You know, something that comes to mind as I was listening as well, you know, the emphasis, Director Garcia mentioned some changes coming up, right? How are we, the impact that those changes are going to have in urban versus rural, right? So how are we, kids who happen to live in rural areas, are we doing something to address that need that they will have access to those services as well? So I'm looking for some of those links that are going to come just to read about it and see if that addresses that as well.
And one, I believe it was Paul. It could have been Donald, but one of them had their hand up towards the end as well.
Oh, please.
I was going to ask just a question that I'm writing up for Anna right now, more about foreign language access as an aspect of our committee's focus with, especially race, ethnicity, national origin, because Northwest Iowa, yes, there's Spanish and there's Spanish speakers, but Guatemalans have native languages that many of them have around here. So I was just curious what they have focused on access when it comes to issues of language. So I'm going to type that up because I won't be able to be here next week. So that's all I had. Thank you, though.
Thank you, Paul.
I had that same question, so great minds, Paul. I just wrote that. I'm typing it up as well, and between language barriers and cultural barriers. So excellent.
Yeah, and I think the language part is going to be important because, you talk about lack of access, and now you have lack of, even if I speak English as a second language, or I'm learning English as a second language, I'm more likely to be more comfortable and be able to share more if I do it on my own language. So, oh, 1 second. Amazon is at the door. I'll be right back. My apologies. I kept ringing the bell. Okay, so we can move. Any other comments? Or can we move into the review and the project timeline? Okay, Victoria, are we on track?
Yes, you're on track. I don't see any other hands raised at the moment.
Perfect. So next week, moving to number 3, I am traveling. I will be in Puerto Rico attending a conference for work, and our vice chair, Henry Hamilton, will be leading the meeting. Thank you for the slide. Does anybody see any issues with where we are and the dates that we have? So after next week, we can decide whether we need to have a four-web briefing or not, and then identify who else we want to invite, if any, if there is a need to do that.
Chair, I see Stephanie has her hand raised.
Miss Stephanie.
I was curious about, we had talked at some point having some youth representation. I don't know if there's going to be more of that coming up. I don't see it on the agenda for next week, but perhaps the 4th one could be a time for
that. Will be awesome.
that.
Just having actual people who are using the services or benefiting from the services to share their perspective. Yeah, great point.
I would really like to hear from them, and if they prefer to send it via written, if they don't want to, we understand being younger folks, but I would really like to hear from people who are impacted.
Did we discuss as a committee who had access to people that might qualify to do that, or people that we know that are getting the services?
I mean, I know several youth, but I mean, I can ask.
Yeah, and I think it's also some of the speakers today, right? I mean, we have LSI. We can check with them and see if they're able to connect us with some students in a couple of weeks.
I did raise some questions way back when we were talking about it, about, I just want to make sure children on either side don't wind up being put forward, used as mouthpieces for other things. And do we need to get parents' permission?
Yes, that is huge. And also, I think we can, as a committee, and I don't know, we'll have to check with Victoria or Anna, can we leave the names out, right? If we're talking about someone who provided some written testimony, maybe we can say, their age and that it was approved by their parent and leave their names out. Because I'm a firm believer that is we're trying to address or put an emphasis on what is going on with those services. Not talking to the people who are getting the services is a disservice, right? Because otherwise we're just hearing from the providers and the policymakers and the state agencies, but we're not actually talking to the people who are impacted by it.
Yeah, I think we should absolutely leave their names out of it, or any other kind of identifying information. It may help just to contact the folks from this panel and the last panel, maybe even the third panel, and just tell them that we're looking for, youth voices. We want to hear from the people that are being impacted, and see what suggestions they may have. And Alan has his hand up on.
Mr. Allen.
Yeah, I would just want to flag that I don't want us to make promises of confidentiality to a juvenile without somebody in the Commission on Civil Rights, some attorney telling us that that's within our power to do. So I would like us to get an attorney sign off on that before we went down that path.
That is a great point. And Victoria, perhaps that's something that we can check with Anna or you or members of your team before we do any outreach to anyone.
Yes, of course. I'm making a note of that so that we can inquire further.
Yeah, that will determine what we do next, right? And thank you, Alan, for bringing that up, because I think is a good point. Okay.
Chair, one note, if I may, is that I know Anna wanted to highlight that these timeframes that you see on the screen, they're tentative. And that if the committee is interested in having an additional panel due to the logistics of identifying the speakers and so forth, realistically, that won't be held until late July, just to give everyone an idea of the timing for that.
Okay.
But she'll be in touch with the chair and vice chair regarding availability and scheduling and so forth.
Okay, sounds good. And I think all depends on whether we can get testimony from the youth or not. Oh, sorry. Okay. Any other questions or comments? Look at us, not even 4:30 and we're done. This is awesome. So Victoria, Corinne, anything else from your angle?
No, nothing else at this time.
Okay, my friends, then I'm going to request a motion to adjourn the meeting. And do we have one?
So moved.
So moved. Second.
All in favor? Aye.
Aye.
Thank you, my friends. Thank you for your time, dedication, and more work to come. And I my best wishes to you and your families for an incredible Memorial Day weekend. And you will see Henry next week, and we'll continue the conversations and be on the lookout for emails from Anna and Victoria on the follow-up questions that we have.
Okay, safe travels, Juan.
Bye.
Everybody,
All right.
have a good one.
Thank
Bye,
Bye-bye.
everyone. Enjoy.
Thank you.
Thank you. Take care, everybody.